Hi there. I listened to Professor Mick Cooper's analysis of CBT with some interest. Just to let you know a little bit about me, I'm a focusing and experiential psychotherapist, and I run a private practice. I'm also a drugs counsellor at a local drugs service. Um, I think that the criticisms of CBT perhaps can be divided into perhaps a critic of some of the theory around cognitive behaviour therapy, and also the other question, of course, is whether or not CBT does work in producing deep-seated and long-lasting healing. I also just briefly want to comment on Professor Mick Cooper's criticism of these random trials as well. I think the sheer amount of research on CBT, and particularly comparing CBT to doing nothing, is almost guaranteed to produce better results for CBT than doing nothing. And in a sense, therefore, it isn't really telling you very much about CBT. It's just telling you that it's better than nothing, but it isn't telling you how good it is. I want to start off with some criticisms, perhaps, or at least my own critique of CBT as a therapeutic practice. And one of the things that I'm very, very concerned about is that there is, if you like, a highly suspect idea right at the root of cognitive behaviour therapy, and that is that distorted thinking patterns lie at the root of psychological disturbance. And therefore, for example, in advanced CBT courses, they talk about delving down to distorted thinking patterns. They talk about challenging distorted thinking patterns. They also talk about challenging core beliefs and changing core beliefs. Now, on a purely theoretical level, leaving aside whether it works or not, to me this is highly dubious, highly suspect. Who is actually to say which core beliefs are indeed correct or not? And who exactly is it who determines whether thinking patterns are genuinely distorted or not? Now, of course, we can all point out, for example, logical flaws in people's arguments. That's true. But to make those judgments is indeed highly complex. It's not simplistic. In the Chinese re-education camps, it's considered wrong to think differently, for example, from the party. And they use what in effect, what in CBT is called cognitive restructuring or cognitive reframing, is indeed standard in the Chinese re-education camps. But who is to say what cognitive reframing is actually correct? My concern on a theoretical level is that this really does look not like therapy but brainwashing, and that is something as a human being that I find deeply disturbing. Now, in terms of the effectiveness of this therapy, there is indeed a report, for example, by Professor King, published in the year 2000, which looked at person-centered counselling. It looked at CBT, and it also looked at regular visits to doctors' surgeries as part of a planned treatment program. And what it found in terms of outcomes, in terms of people actually feeling better by the end of the therapy, was indeed that they were all broadly equal. The regular visits to doctor's surgeries was slightly less effective than person-centred and CBT. What they also looked at was how satisfactory and how rewarding an experience it was for people. And what they found here was that person-centred counselling was a lot more rewarding for people as an experience than cognitive behaviour therapy or regular visits to a doctor's surgery. And this report, it's a very big report, it was a massive study, would certainly support the contention of Professor Cooper that perhaps it is the things that CBT has in common with other therapies, i.e. the therapeutic relationship and the engagement of the client, that are predictors of success, rather than the unique features of CBT, such as the attempt to actively change both core beliefs and so-called distorted thinking patterns. And that, of course, is also supported by another study called the Castanet, I think it's called the Castanet study, which showed just that when a therapist concentrated on distorted thinking patterns and trying to change them at the expense of the therapeutic relationship, that in fact it was negative to client outcomes. Now I just want to also comment in a very general way from my own private practice. What I've found is that I've had clients come who've been in CBT, and what they say is that after having some focusing and experiential psychotherapy, is that the contrast is that CBT actually gave them a lot of techniques for distancing themselves from their emotional disturbance and their panic attacks, from suppressing and quashing their panic attacks, but it never actually got to the roots of the issue. Now, of course, those people, I'm quite sure, would have had tick boxes saying that they were a success with CBT, but of course it all depends how you do success. Now, when they've had a few sessions of focusing on experiential, basically body awareness, seeing how things feel in the body rather than just the head, and trying to and experiencing and sitting with things, they've actually said, well, the panic attacks have now gone, the depression has begun to ease, I'm no longer having a battle with it, it's beginning to be integrated and changed. And, I think that CBT in many cases is a quick fix that sort of gets people functioning but doesn't deal with the root issues. Now, it may be true that people at the time they have CBT are not capable of dealing with the root issues. Maybe they do need to be patched up so that later on they can actually do deeper work. But I think that this certainly shows that an idea of a one-size-fits-all policy is indeed completely absurd and wrong. And what we should be having is indeed a rainbow approach, where people can have choice, people can choose different types of therapies, and where we look not just at the outcomes, but also about how satisfactory and rewarding an experience it is. So, that's my comment. I personally think that CBT is intellectually deeply flawed. I haven't got time to go into that in such a short video, but I'm hoping that this is an interesting contribution to the debate. Many thanks.